1 in 3 of us will require a blood transfusion at some point in our lifetimes. In this episode, I discuss why I donate blood and why, if you're able, you should consider doing so too. To start this episode off, we're headed to New York Blood Center so I can do just that. Hey guys, I'm Dr. Mudgil. I'm a dermatologist and dermatopathologist based in New York City and Long Island. I'm a New York Times super doctor and a Castle Connolly top doctor. I practice cosmetic, medical, and surgical dermatology. Welcome to the Dr. Mudgil Show. So we're here at New York Blood Center in Huntington, Long Island, getting ready to donate some blood. I got an email a couple of days ago that they were in need of type O blood, and I have type O blood. Type O positive blood, so I'm almost a universal donor. If I were O negative, I could donate blood to anybody, but I can donate blood to anybody who has positive blood, whether it's A or B or AB. So I'm going to donate a pint of blood today, and I try to do it every few months just to help out in any way that I can.
How have you been doing, okay?
I'm good, man.
Did you eat yet?
Yeah.
Good. Never give blood on an empty stomach, okay?
You been doing it a long time?
Oh yeah, 18 years.
Wow, true professional.
You know, it's for a good cause, you know?
Yeah, totally, man. O positive, man. So.
O positive? Oh yes. We've been waiting for your blood. Even though you see 3 bags, but it's only one we actually collected, okay? We're about to get started momentarily.
Nervous?
Not my first rodeo.
Yes. You may hold on to this, bro. Alright. You may elevate this arm. Keep it up for me, okay? You're gonna gently apply a little pressure. Open and close, open and close, open and close. Keep pumping. Purpose of it is to actually trace your vein, okay?
You missed this stick, man. You know, you're gonna get a new job, man.
I want that cigarette. No way, Jose. I don't miss, okay? Now when it comes to needle and venipuncture, I try not to miss at all. All right, gotta clean up. Doesn't mean that you're dirty. Only part of the procedure, okay?
You ever have someone pass out, like in the chair?
Yes, indeed.
Really?
Oh yeah. That happens, you know. Like I said, 18 years doing this, I've seen a whole lot. But we do pay attention to everyone, though. You know, before you do actually get up. You know, we'll confirm, make sure that everything is going fine. You know, so no lightheaded. You feel 100% before I walk you over, okay? Birthday's coming up.
That's it.
That's right. Happy early birthday, man.
Thanks, man.
You're welcome. You want to see the size of the needle for real?
Oh yeah.
It's a 16 gauge. Hold that, okay? Thank you. Ow! We're good to go. Okay, once I can trace the vein, find it, like they said, drop it like it's hot, and just keep it going, okay? Yes, sir. If there's any discomfort, do not hesitate to let me know, okay? So you know the purpose of collecting every vial of tubes, right? Is to actually run testing
Checking for diseases?
Yes, absolutely. And that'd be nice, transfusing something tinted, you know, to someone that needs it.
Do you guys check for Lyme and babesiosis and all that stuff too?
Mm-hmm. By law, we have to test everything out, okay? That consent decree you do sign when you're filling out the form, yes. By law, we have to respond back to you. We call you and notify the donor.
So far, so good.
Yeah, so far so good. Right? It should be fine.
How are you doing, more importantly?
I'm good. I'm good. Thank you. I'm good. Can't complain. It's beautiful out there. The weather too is not too hot, not too humid. We're at a good number, 182 ml so far. Okay, you're flowing. Remember, the body has 7 pints of blood for every 100 pounds you weigh. So 7 bags of those. So you do the math. You're 200 pounds. You do the math on your numbers, on your weight. Okay. You're 185, so you got less than 14. Make sure to exercise you're doing, okay?
Yeah, I already got my exercise in for the day. So.
For the day, right? Yeah, good. And you eat a good meal, drink a lot of fluids, stay hydrated. That's a good rule, okay? Thanks.
How do you feel?
Feel good? Feel great.
And he only played for 2 minutes, had 11 points.
He was crushing there.
Yeah, 11 points, 2 minutes? Imagine the whole full,
He came to play.
He came to play. He's truly good. We all finished. 12:30 exactly. You got the record of the day so
What's the
far.
fastest ever?
Oh, you don't want to know. I
Come
met
on.
a girl one time. She was at 3 minutes and 40 seconds.
Oh, really?
Now, I knew I didn't hit an artery because the color of the blood was
Yeah.
actually the real color.
Wow.
Thank you, brother. Time to get this baby out now. All right, this is the fun part. I want you to take a deep breath, 1 and 2. Thank you, sir. Got you, brother. Thank you. You may put 3 fingers here. Deep brush.
Hands up or?
Yes, you could. Yep, raise it up. Okay.
It's a wrap. That's it.
It's a wrap.
Record of the day.
That's right.
Number
Take
one.
that
Number
550
one. First place for the day. Quickest pint.
For the day, baby.
Quickest pint in Huntington.
There goes his blood. There you go. Thanks.
One pint of blood can save 3 lives. 1 in 3 of us are going to require a blood transfusion at some point in our lifetime. Every 3 seconds, someone needs blood. If you're able, donating blood is the most precious gift you can give to a fellow human. So I'm type O blood, which means I'm the universal donor. I can donate my blood to anybody. Well, almost anybody. Let me break this down a little bit. So there are 4 blood types: type A, type B, type AB, and type O. There's also something you may have heard of called the RH factor, which is the positive or negative behind your blood type. So I'm type O positive, which means that I can donate my blood to anybody that has a positive blood type. So I can donate to A positive, I can donate to B positive, I can donate to AB positive, and I can donate to O positive. But I can't donate to somebody that's A negative or B negative or AB negative because our blood's not compatible. The true universal donor is type O negative blood because an O negative individual can donate to anybody. They can donate to someone who's A positive or A negative. So the true universal donor is type O negative. The true universal recipient is type AB positive. So let me give you an example. I'm type O positive blood, which means I cannot donate my blood to type AB negative, or rather type AB negative cannot receive my blood. Type AB positive can receive my blood, and type AB positive can receive any type of blood. O negative, O positive, A positive, B negative, it doesn't matter. AB positive can receive anything. O negative can donate to anybody. That's how it works. So earlier I mentioned that 1 pint of blood can save 3 lives. Let me show you how that works. I'm a terrible artist, by the way. So here's our pint of blood. 1 pint of blood is broken down into its 3 components: red blood cells, which last about 42 days, platelets, which last about 5 days, and plasma, which lasts about a year. So let me tell you how you can save 3 lives with 1 pint of blood. If someone is anemic, they don't have enough red blood cells in their system to carry oxygen to their organs. So you donate your red blood cells to them and you save their life. If someone doesn't have platelets, they're unable to form clots and they can bleed internally and externally. This can happen a lot in cancer patients. So you donate your platelets to them and you save another life. If someone has liver disease, they're not able to form clotting factors and they can also bleed. Plasma contains a lot of clotting factors, so you donate your plasma to them and you save another life. So there you go, 1 pint of blood saves 3 lives. So the reason why there's a continual demand for blood is because each part of blood has a limited shelf life. Blood cannot be manufactured. It can only be taken from one human and given to another human to save their life. So now that you know why it's so important to donate blood, when we come back from the break, we're going to talk to my friend and colleague, Dr. Jerry Clements, who's been on the front line of New York City healthcare for the last 30 years. Trusting the process. It's all about trust in the process that gets you to your goals. Now, whether your goals are to lose weight, to get in better shape, to get your general health in order, to learn a new instrument, it's trust in the process that's going to get you there. Let me use my own personal fitness journey as an example. It took me years to get into the shape that I desired. I'm talking 5 years is what it took me. And I didn't notice any change workout to workout or week to week. It was over the course of months that I would see a small incremental change. Small change upon small change upon small change is what leads to massive results. It's those small little changes that all add up over the course of months or years that lead to a massive change or a massive movement towards whatever it is that your goal is. So let's trust the process. Let's get it. So I'm here with Dr. Jerry Clements, who started a practice about 30 years ago. It has been in practice for longer than 30 years in Greenwich Village, New York. And I'm super psyched to have Jerry here because he's been practicing a little bit longer than me, has seen quite a lot being a doctor in New York City. Just to give you a little background, Jerry's practice started back in the early days of HIV when doctors didn't even know what HIV was. I imagine when you were a resident, patients were just kind of walking in very, very ill and you had no idea what they had. And over the course of all those years, you've really seen it all. And this episode, Jerry, is all about why it's important to donate blood if you're able to. Jerry, like me, is type O positive blood we established, so clearly all the best doctors are O positive. But maybe you could just shed a little bit of light about how in your career you've seen a need for folks to donate blood, a shortage of blood, and what you use that for in patients that you've seen through the years.
Right. Well, back to the HIV crisis, the worst problem that we had no treatment. And so we were grasping at straws, trying to find something that helped a little bit, and mostly nothing did. That's all changed, and it's so wonderful that we can not only keep people alive and keep disease in check, but it seems like we can reverse the disease process or stop it with medications now, and certainly keep it from spreading, so it's amazing. But yes, those patients were often in need of blood transfusions, and sometimes it had to do with internal diseases that bled, and we were probably using much more of the blood supply than we had anticipated, and there was always a concern about the supply. And I think the second problem was that the authorities who were in charge of monitoring the blood supply were not sure how to even test it to see if it was safe to have people donate, who could donate, where they could travel, who they could be, what was their sexual orientation, did that really matter, could we protect the blood supply?
And there was probably a lot of tainted blood in the blood supply.
And there was, with hepatitis, with other diseases. And so it made for even a greater shortage than there would have been in terms of what we could have donated. Some of that's been straightened out. There's still some problems with, I'm sure there's still some problems with sort of, whether somebody, for example, who's traveled to England and eaten meat how soon they can donate, that sort of thing, certain diseases. But I would say that overall, it's always been a concern that we'd run out of blood.
It's so interesting that you say that, Jerry, because when I was donating blood, one of the first things they do is they take 3 or 4 tubes of blood to screen you for all these various diseases. So obviously they're screening for HIV, hepatitis. They also screen for Lyme disease, babesiosis, anything that can be transmitted in the blood. And before you even donate blood, every time, I do it periodically, every few months I donate, and there's this really extensive questionnaire that you have to fill out, which screens for things like, have you been in England during such and such time, screening for, Creutzfeldt-Jakob and that sort of stuff. So it's, I think because of everything that's happened and, sort of having at some point a tainted blood supply where you didn't know that things could be transmitted from patient to patient from donating blood, this is going back 30 years or so, it's become a very efficient, streamlined system. And, I think patients can feel very comfortable that their blood that they're getting, should they ever need it, and 1 in 3 people are going to need some kind of transfusion at some point in their lives, you can be pretty confident that what you're receiving is safe, it's been screened for any transmittable diseases, and that you're not going to get sick from getting a donation.
Yeah. And my feeling about the blood supply in New York City is that we have a system in place that sort of ensures that somebody's watching and making sure that we don't run out. I'm not quite as sure about the rest of the country, where I don't practice, where I don't keep tabulations, but my sense is that you don't have the personnel in every part of the country to ensure that somebody's watching on what the supply is. I've never counseled a patient to be careful about receiving a blood transfusion in terms of disease transmission, because I think we're extensively testing for anything that we know of in the blood supply. And the same goes with, I've never counseled a patient not to donate based on, you know, how we do it and what the techniques are, and how it'll impact on their health. You know, if they give every few months or something like that.
Can you speak to that a little bit? Is there any impact on someone's well-being by donating blood?
If somebody starts out anemic, let's say with a low blood count, then obviously they don't qualify for donating blood until their blood count's up to a minimal level. If they have some other types of chronic disease that affects their everyday energy and so forth, they might be a little bit more reluctant to go in. But in general, it's just simply a measurement of what your blood count is. If your blood count meets a certain minimal criteria, then it's quite safe, because we replace our own blood in a matter of a few days, and certainly in a few weeks, we're back to where we started.
It's almost like a workout for your bone marrow, some people
Well, that's an interesting idea, that it would be, you know, I've never stated to anybody it's going to improve your health to do so, but certainly not impact adversely on their health.
So Jerry, can you talk to us a little bit about blood typing, and if patients ask you about it, and, you know, what they need to know, if there's anything special that surrounds the type of blood that you have?
When I do routine blood tests on someone, say for an annual physical, it usually does not include their blood type, especially if they've ever had it before, because we don't expect their blood type to change in their lifetime. Often I'll get the question when I'm reporting their results, like, oh, what's my blood type, doc? And I'll answer, oh, you know, something we don't generally check that, and one reason is it may be in your record somewhere just for information purposes, and the second is the blood donation sites do not accept my word, your word, anybody's word for your blood type. You will be tested immediately upon, you know, either receiving blood or donating blood, so that there's no mistake made. It's almost a question just of personal interest. It's not something that you have to keep in mind, even though it might be good to know if you were a universal donor, so that you could be more aggressive about donating blood. But in general, people want to know, I think, just because it's a curious thing, and they want to know a little bit about their heredity and so forth.
Interestingly enough, there are a bunch of fad diets that are...
And their diets?
Yeah, you know, if you have type A blood, this is what you should be eating. If you have type O blood, this is what you should be eating. Do you think there's any value to
I've had people ask for their blood type to help determine what they should be eating. And I do believe there may be something to that. There are regional foods that go back to ancient times where our bodies were maybe designed to digest certain foods, and so there may be something to that, but I don't think science has been able to demonstrate that. So
I agree. All right, awesome. Well, Dr. Clements, this was amazing. I think this is shedding a lot of insight on donating blood. One of the things that I hope folks will take away from this episode is that if you're healthy enough to, blood only has a very short shelf life. And if you're able to donate blood and you're healthy enough to, I'm trying to encourage folks to get out there and do it, because, you know, there's always a need for blood. And like I said, 1 in 3 of us are going to require some sort of transfusion at some point in our lifetimes.
Right. It's not scary. It's not dangerous. You'll feel okay afterwards, and you'll be doing us all a service.
Absolutely. Well, thanks, Jerry. I really appreciate your time.
Thank you so much for watching this episode. I hope you now have a better understanding of why it's so important to donate blood if you are able. If you are in the New York City area and would like to see me as a patient, you can contact me at either one of my offices. You can also find me on YouTube, Instagram, Facebook, and Twitter. We'll see you next time.